Welcome to This Explainer. Today, we're diving into the really fascinating convergence of traditional Ayurvedic practices and modern clinical medicine, specifically looking at how they can team up to combat chronic disease. I am so thrilled to take you through this. We're looking at a true paradigm shift today, one that doesn't ask us to pick a side between ancient traditions and modern science, but actually shows us how they can seamlessly interlock to create a much more complete picture of human health.
So, can ancient wisdom cure modern disease? Well, let's unpack this intriguing question by looking at exactly why modern healthcare is increasingly turning toward integrative models. For decades, we've treated modern medicine and traditional systems like they were in some sort of tug of war. But as we're going to see, a massive and growing body of scientific literature is proving that they actually provide incredible complementary strengths, especially when we're up against a rising tide of really complex modern illnesses.
Right now, we're facing a massive global burden. I'm talking skyrocketing rates of cardiovascular disease, diabetes, obesity, and autoimmune disorders. And these aren't just caused by a single germ you can easily zap. They're incredibly complex puzzles driven by a huge web of factors: genetics, chronic inflammation, metabolic dysfunction, oxidative stress, and of course, our environment and psychological stress. Now, modern medicine is fantastic, absolutely brilliant, but it often targets just one or two biological pathways at a time. Chronic conditions, though, they literally demand a multifactorial systems-based approach to tackle all those interconnected physiological systems at once.
To really understand this paradigm shift, we'll be following this roadmap today. We'll start with the chronic disease challenge, compare our two distinct medical paradigms, dive into the science of integration, explore the mechanisms of holistic healing, prioritize patient safety, and finally, look at a collaborative healthcare future.
Section 1. The Chronic Disease Challenge, the Residual Burden. Let's start with the incredible triumphs and, frankly, the notable limitations of our current healthcare framework.
So here's the reality. Modern medicine is an absolute miracle for acute care. It is unmatched at prolonging life. But there's a catch. Patients with chronic conditions often still suffer from what we call a residual burden. This means persistent fatigue, lingering inflammation, or tough medication side effects. Basically, despite getting top-notch guideline-directed care, a lot of people are living with impaired daily function. That residual burden is the frustrating gap where you are technically managed by pharmaceuticals, but you sure don't feel well.
Moving on to Section 2. Two distinct medical paradigms, the firefighter versus the architect. This really highlights the fundamental differences in how conventional and traditional systems view healing.
The best way to think about this is a metaphor. Think of modern medicine as the firefighter. It expertly puts out acute blazes. Make no mistake, it remains the absolute gold standard for emergency medicine, surgery, advanced pharmacotherapy, and managing life-threatening diseases. If you're having a heart attack, you need a firefighter, right then and there. But Ayurveda, it acts as the architect. It contributes comprehensive strategies for disease prevention, lifestyle and behavioral optimization, nutrition, and stress management. It's looking at your daily routines to build long-term systemic resilience so that the fire never even starts in the first place.
Section 3. The Science of Integration, a clinical synthesis. This brings us to a cohesive model where these two paradigms stop competing and actually start supporting each other.
When we map this out, you get a beautiful, continuous cycle of holistic patient care. We move seamlessly from preventative strategies right into personalized medicine and ultimately toward minimizing drug dependency. It's this brilliant feedback loop. Ayurveda steps in to address the root lifestyle causes and the mental health components, effectively filling the exact gaps that Western medicine sometimes leaves open in long-term chronic care. And when we break it all down comprehensively, we can see exactly where specific, evidence-based Ayurvedic interventions fit right alongside conventional treatments. Take ashwagandha for stress and anxiety, for instance, or curcumin for joint inflammation in osteoarthritis. The science here is absolutely key. Emerging evidence shows these interventions can seriously reduce inflammatory signaling and improve metabolic function. But, and this is a big but, integration relies on hard data. Right now, the overall quality of evidence is pretty heterogeneous. Some botanical effects are backed by highly rigorous randomized controlled trials and meta-analyses, which is great, but others still rely mostly on observational data or traditional knowledge, meaning they should merely serve as supportive adjuncts to conventional therapies.
Section 4. Mechanisms of holistic healing, the molecular level. To truly appreciate how this works, we need to look under the hood at the rigorous biological science.
Okay,
I love this part because it's not just ancient theory, it's modern molecular biology. There is a direct mechanistic parallel here. Over the past 2 decades, experimental studies have identified specific active principles in these plants, like with analytes in ashwagandha, boswellic acids in shilajit or bacosides, and guess what? They exert potent anti-inflammatory, antioxidant, and immunomodulatory effects. We are talking about physically modulating cytokines and inhibiting leukotrienes, targeting the exact same inflammatory pathways as conventional drugs like NSAIDs or corticosteroids. That biological plausibility is exactly why these botanicals are such powerful sidekicks to modern pharmacology.
And it's not just the herbs. We so often think of yoga as just physical stretching, right? But the physiological impact tells a completely different story. Regular practice literally drives down inflammatory markers like IL-6 and cortisol, while massively boosting cellular protection. It lowers C-reactive protein while simultaneously upregulating antioxidant defenses. It is a profound, measurable change in your body's baseline chemistry. And the effects go way beyond just changing circulating biomarkers. Ayurvedic lifestyle modifications actually alter your epigenetic expression at a cellular level. Look, your genes are not your definitive destiny. They just aren't. They are continuously interacting with your environment. The foods you eat, the quality of your sleep, meditation. These literally tell your DNA which genes to turn on and off. You are fundamentally altering the transcriptional regulation of your cells, suppressing inflammatory gene expression over the long haul. Honestly, this is systems biology and precision health in action, and it's incredible.
Section 5. Prioritizing patient safety, the non-negotiables. We cannot talk about integration without having a very serious conversation about clinical governance and risk.
Let's do a quick reality check here, because assuming that natural remedies are automatically safe is a hugely dangerous misconception. A central theme of any integrated healthcare model is that integration must never, ever compromise patient safety. Inappropriately substituting proven conventional therapies with unvalidated alternative treatments can expose patients to severe, avoidable harm, especially in acute illnesses, cancer care, severe infections, or cardiovascular emergencies.
This creates an absolute, non-negotiable requirement for transparent communication with your doctor. Why? Because Ayurvedic herbs are pharmacologically active. They can actually alter how your liver enzymes, specifically the cytochrome P450 system, metabolize your prescription drugs. That can lead to increased toxicity or reduce the efficacy of life-saving medications, like increasing bleeding risks with anticoagulants. Add in global concerns about inconsistent manufacturing standards, potential contamination, and heavy metals, and it becomes crystal clear why robust pharmacovigilance, independent quality testing, and completely shared clinical records are mandatory for safe integration.
Finally, Section 6, a collaborative healthcare future, total integration. When properly governed, the future of medicine is a deeply collaborative, multidisciplinary ecosystem.
The ultimate goal places the patient firmly in the center. We have conventional Western medicine providing evidence-informed acute care on one side, alongside traditional healthcare systems providing mind, body, and lifestyle interventions on the other. But this requires immense collaboration among physicians, pharmacists, nurses, dietitians, and complementary practitioners. To make this work safely, we need robust educational programs so doctors actually understand traditional therapies, and traditional practitioners understand modern pharmacology and pathology. Basically, we all have to check our egos at the door for the sake of the patient.
True integration demands rigorous scientific evaluation, mutual professional understanding, and absolute transparency. As this quote perfectly summarizes, the safest herbal medicine is the one whose risks and interactions are fully understood by everyone involved. We have to move way past the era of patients secretly taking supplements they bought online without telling their oncologist. The safest path forward is fully illuminated, driven by evidence-based guidelines and completely open dialogue.
So, what would your healthcare journey look like if it proactively treated your entire biological system rather than just waiting around to treat your symptoms? Thank you so much for joining this explainer. I'll leave you to consider how an integrated, systems-based approach might completely redefine your own long-term health trajectory. The synergy of ancient wisdom and modern medicine isn't just some fascinating concept. It really is the blueprint for a more resilient, holistic, and vibrant future. It's time we all start thinking like architects of our own health. Catch you next time.